Hey y'all, so welcome back to my channel. Today's video is going to be my first reproductive health video, and I thought I should start off with something simple but something that I know a lot of you have questions about and something that you guys can learn and do with me. It's kind of like an interactive video. So today we're going to talk all about breast exams, and I'm going to show you how to do your own breast exam in the comfort of your own home. The self breast exam is what we call it. So why is it important to do breast exams? Number one, I like to tell patients that doing a breast exam, especially on themselves, shouldn't be something that's nerve-wracking and you're like, oh my god, like if I feel something odd, does that mean I have breast cancer? Like, no. I like to think of it more as just like breast awareness and just, you guys getting a little bit more comfortable just touching your breast and feeling what your normal breast tissue feels like, so that when you do feel, throughout the months and years, you'll be able to recognize when something feels off to you. So doing breast exams is an early way to detect possible abnormalities in the breast. It also helps provide early treatment of breast cancer possibly, and also to reduce the mortality rate, so people dying from breast cancer. Breast cancer is something that is really close and dear to my heart. My grandmother, she passed away from breast cancer, and ever since then I've become kind of obsessed with just feeling my boobs all the time. So yeah, so if you're interested in seeing how to do a breast exam, continue to watch. So guys, the first thing you want to do is be standing up. You want to ensure that you have no shirt on and no bra, so we're just going to pretend, because YouTube, we can't be naked out here. The first thing you want to do is inspect your breasts. So you want to put your hands on your hips and just take a look at your breast. Look at them, get to know them, get to know what they look like, the shape. Many women have one breast that is larger than the other. For me, my left breast is just a slightly bit larger than my right breast. Super normal. Just know which one is which. Then you want to just be looking at the skin, looking at the texture of the skin, looking to see if you can see any visible masses or lumps or things like that sticking out that's kind of making your breasts look a little bit more asymmetric. Also, you want to observe your nipples. So look at your nipples, look at the color of the nipples, look at the shape of the nipples. You want to look to see if your nipples are everted, if they're flat, if they're inverted. These are all normal. You just want to know exactly what kind of nipples you have. So take a look at them. Also, you want to look to see if you see any discharge coming from your nipples, just spontaneously, any discharge, because anything bloody or, malodorous smelling, green, yellow, all those type of colors, that is something that you would want to let your healthcare provider know. Also, you want to inspect to see if you have any redness of the breast, any swelling of the breast. Also, if one of your breasts are really painful. These are all things that can be abnormal signs. But also take into account that your breast changes throughout the month. So it depends whether you're on your menstrual cycle or if not. That's why I would recommend, when is the best time to do a breast exam? Best time to do a breast exam is 1 week before your period. So doing that will ensure that you don't have that tender feeling. Some people's breasts swell and all of those things. So now that we've inspected our breasts and everything looks, intact and smooth, next thing you want to do is raise your arms above your head. And this helps to lift the breast. For people who have bigger boobs, this helps you see underneath. I don't really have that. Clearly my breasts are on the smaller size, so raising my breast, I can see, the bottom of my breast just from looking in the mirror. But if your breasts are a little bit bigger, feel free to, top of your shoulder, to take a look what's going on underneath there. So now that we've done that and we can see everything, the next thing you want to do is put your hands on your waist again, but this time you want to lean forward. So when you're leaning forward, this helps the breasts to kind of just hang and sag, and this helps you to expect to see something called dimpling. And it's exactly what you think. When you have like a dimple in your cheek or a dimple in your lower back, it's kind of like a poking inward or like a little like retraction of the skin. That's something you want to be mindful of, and you would want to definitely let your healthcare provider know if you see any of that, okay? Or if you see any visual lumps that are asymmetric when you're leaning over. So now that we've got the inspection part out of the way, now we want to go into the next step, which is to palpate your breast, which layman's terms, just put them hands on the breast, feel your breast, okay? So we're about to get into that. Alright guys, so now that we've inspected, now we want to go on to actually feeling our breasts or palpating our breasts. So this would be done best laying on a flat surface. You want to do it in like a supine, flat position. And best way is to do it on your bed, your couch, if you have a chaise, something like that. I don't have that today, so we're gonna pretend that I'm leaning flat, or I'm flat on my back. Now, the proper technique to actually feel your breast tissue is to put your arm behind the breast that you're actually going to be feeling. So for this video, I'm going to do my right breast. And some people find that putting a little pillow behind the left shoulder blade helps to kind of align the breast. So put your arm behind your head, and we're laying back. And now we want to talk about feeling the breast. So I like to use the pads of my fingers, and what I like to do is kind of think of my breast in like 4 different sections. So we got the right outer section, the left inner section, the right outer section that's at the bottom, and the left inner section that's at the bottom. So you want to start in the right outer section, and you want to do small circular motion. So you're kind of going like this, like a small circular motion, and we're gonna do a light pressure, and then the second time you're gonna do a medium pressure, and then the third time you're gonna do a deep pressure. Or you can do light, medium, deep, light, medium, deep, light, medium, deep. And so what we're gonna do, we're gonna go in a vertical downward motion, kind of like a lawnmower, up and down the breast till you get to your sternum or your inner chest area. So what am I looking for? That is the question of the day. How do I know if something's abnormal? So let me just tell you what is normal first. Some people have dense breast tissue, which is like more full, thicker tissue. Some people have more, sparse or light tissue. It's not as dense. Oftentimes, with the size of your breast, that can determine whether your tissue is dense or not. Also, with age, a lot of younger people have some smoother breast tissue, and as you get older or have children and you've breastfed, you'll notice that the breast tissue is a little bit more nodular, or you have like a little bit more bumps and lumps and stuff in there. Having those are normal. Having some, lumps and bumps in your breast tissue, totally normal. When it's not normal is when you have, think of like a pea or like a marble, something that's kind of hard and fixed. When I say fixed, it doesn't move. Like normal breast tissue will move as you move it. But if you feel something in there that's kind of hard and it's not moving, that might be a sign or something that you would want to let your healthcare provider know about. Overall, doing a breast exam, I don't want you guys to get overwhelmed or scared. If you think you feel something abnormal, 9 times out of 10, you're psyching yourself out and it is something normal. With this breast exam, I kind of just want you guys to become aware of what your breasts feel like, so that when 6 months down the line you feeling it and something feels out of place, especially if it's like on one side and not the other, then that's something that you can bring up to your healthcare provider. So We're gonna be pretending that we're leaning back, we're flat. We're gonna put our right hand behind our head because we're going to examine our right breast. You wanna put a light pressure, and then you wanna do a medium pressure, and then you wanna kind of do like a deep pressure. These are all different levels because sometimes if you go light, you might not necessarily feel a mass that's like deep in the tissue. So that's why I like to tell people to do different pressures so that you can ultimately feel for anything at all different levels of your breast. So take the 3 fingers. We're going to start on the right outer side, and we're going to literally go up and down. Up and down. And guys, you could do this in the shower too sometimes, standing up. You can just feel all around, feel your breasts anytime. I know laying down is great, but I just want you guys to be aware of what your breasts feel like. All different angles. Going up and down, over the nipple, all of that. Also, don't forget, your breast tissue extends into your armpit. So that's where like that side boob comes in when you wear a bra and it's like kind of poking out the side. You want to feel in there. Now, I should warn you that if you shave your the hair underneath your arm, sometimes people might develop like little bump, like a painful bump that feels like it's underneath the skin. More than likely that is just the lymph nodes are a little bit sore from shaving, and that's what causes it to be a little bit inflamed. So we're feeling light, medium, deep pressure, light, medium, deep pressure. When you get to your nipple, feel free to kind of put the nipple in between your fingers and separate, and also squeeze just to see if any discharge comes out. But yeah, guys, do this once a month, week before your period, and other side, same thing. And that's how you become aware of your breasts and what they feel like and what is normal. Now, if you're uncomfortable doing a self breast exam at home, I recommend the next time you go to your GYN or your primary care provider for an annual physical, ask them. More than likely they'll do a breast exam for you, and you can ask them to show you and teach you, and that will be a good way to know what your baseline is, because when they feel your breasts, they'll know what they're looking for and they'll be able to tell you. Right now, whoever you are, your breasts are all normal. So now you know, okay, starting today, this is what my breasts are supposed to feel like. And if anything changes, then I know this is something that's not normal. So yeah, guys, I hope that helped. If you liked what you saw, please give me a thumbs up. Put down below which breast is bigger than the other for you, and also put some other video requests down below. So until my next video, guys, peace and love. See you later.